Welcome, my friends, to the Bob and Brad podcast. My name is Mike Keenitz, and today I'm interviewing physical therapist Sarah Haag. She is an expert in urinary incontinence and bladder control. She is also the part owner in Entropy Physiotherapy and Wellness and the author of the book Understanding and Treating Incontinence. So, without further ado, here is Sarah. Is urinary incontinence more common in women or men?
Women, unequivocally women. And there's some theories on that, but probably the strongest theory is that one, we have a very short urethra. So when you think about, say, a garden hose, if you turn on the faucet and it's a short hose, you're going to have pretty strong water coming out. If that hose goes all the way to the back of the yard, that pressure isn't going to be so strong at the end of that longer hose. So that's one thing. The other thing is that in our pelvic floors, because in a female pelvic floor or someone who's born with a vagina, there's a larger opening in the pelvic floor called the urogenital hiatus. So where men have a pelvic floor that really comes together and the urethra just kind of punctures through it, a female pelvic floor tends to have a larger gap. So even if someone has never had a baby or a vaginal birth, we already have a little less muscle right there in the middle. And then also, if you add in someone who's gone through pregnancy, we have pressure on the pelvic floor over the course of 10 months. And then if it's a vaginal birth, we have that pelvic floor stretching a lot. So those are all things that increase the likelihood of females having more urinary incontinence than a male.
Sure. And yeah, I'm assuming if you have more children, are you more prone to develop it later, or?
Yes. So having more children, especially if they are vaginal births, and especially if there's any sort of instrumentation involved, that increases the likelihood of muscle injury or tearing. The more often you do it, yes, the more, I would say the more likely the increased risk you would have for urinary incontinence.
Is there, so when I think of urinary incontinence, I normally think of older generations, 60, 70 plus. I'm assuming you still see young people periodically, don't you?
Yes. And actually that you see it in the people you wouldn't expect. So some risk factors as people age that might cause urinary incontinence, you wouldn't anticipate seeing any of those with younger people. But high-level female athletes actually can have, depending on the sport, a fairly high level of urinary incontinence. In fact, I was speaking with a gymnastics coach, and they actually kind of choose their leotards based on the color that will not show that when that happens. And it's just kind of, it's normalized. And I'll say you never want to make fun of someone, but I think also ignoring it certainly doesn't make it go away. So we see high rates of urinary incontinence and pelvic floor dysfunction in general in gymnasts, runners, dancers, but then also, like, it's certainly not isolated to those athletic events.
Is that just because they're more, lower extremity oriented sports and flexibility based, or why does that happen to them?
I would say the research is still out on that. It's certainly being looked at more often. I think one of the theories going is that it would almost be like more of like a high tone pelvic floor as opposed to a weakness. Because most of these athletes, in some of these studies, these athletes haven't had any children or any pregnancies. So kind of like if you imagine my bicep, let me see which way to go. Okay, so if I have my muscle here and I have a ginormous bicep, looks like I'm super strong. But if I can't straighten my arm, is that strength very helpful? Or is it really strong, or is it just stuck? So you want muscles to be functional. They have to contract and relax. So with the pelvic floor, it should contract but also relax. So that's why when we were doing the pelvic floor contractions, is I asked, okay, did you feel that tension? And then did you feel it let go? Because both parts are equally important. And if I were to share my clinical experience, I'm not aware of any large studies, but I have seen many more people in the last, I would say, 4 to 5 years where their issue was not weakness, but rather their inability to relax their pelvic floors.
Sure. I've never heard I would not expect athletes to have this problem because like you said, I think stronger muscles. Why would this happen? But